Hi, welcome to TLC Academy. My name is Anne Blackburn and I am the Nurse Case Manager from the West Lebanon office. In today's presentation is care of the bedbound client. As a home care provider, one of the most challenging things you may be asked to do is to care for a person who doesn't get out of bed. Being bedridden is a form of immobility, and this can present as an inability to move at all, or even to sit up by oneself or with help. Being bedridden differs from bedrest in that bedrest is a form of non-invasive treatment, and it's usually part of a recovery plan or a limitation of activities. Clients that do not get out of bed are at increased risk of developing pressure sores, blood clots, pneumonia, depression, and loss of muscle strength and endurance. So you want to know, what is a pressure sore or a pressure ulcer? A pressure ulcer is an area of damage to the skin and underlying tissues. The first sign that a pressure ulcer is forming is usually a discoloration or a change in the temperature of the skin. This can get progressively worse and lead to an opened wound. The most common places pressure ulcers occur are over bony prominences, which would be your shoulders, elbows, knees, hips, and your coccyx. What are the causes? Pressure ulcers develop when the blood supply to an area is compromised. A lack of blood supply means that oxygen and nutrients do not reach the area as they should. This causes the skin to break down and an ulcer or an open area to form. They occur when an area of the body is put under pressure for any length of time. Pressure ulcers are more common if a person must stay in bed or stay in a chair or is unable to move around or change their positions for any length of time. Other causes of pressure or open areas include sliding on the sheets or slumping in the bed and the chair. This can damage the skin and the deep layers of tissue underneath the skin. That is also called shearing. Poor lifting and moving can create friction and remove the top layers of the skin, and if done repeatedly over time, can lead to breakdown and damage. Early signs of pressure damage to watch for are changes in skin color. It could be that it turns red or it turns dark. Feeling of heat or cold at the site. Swelling, discomfort or pain at the site, blistering of the skin, other skin damage. And who are the people that are most at risk to develop a pressure ulcer? You are more at risk of developing a pressure ulcer if you have had one in the past or currently have one, if you're unable to move parts of your body or to change positions by yourself, if you are seriously ill or undergoing surgery, if you've had an injury such as a broken leg or a broken hip, or chronic conditions like stroke, nerve damage, diabetes. This reduces the sensitivity to pain and discomfort, and so you don't know when something is happening because you can't feel it. If you've had an epidural, which is a spinal anesthesia, or medications that reduce your ability to move. Poor appetite in a poor diet, or if you don't drink enough fluids also will put you at risk. If there's a cast on a limb, if you're the very old or the very young, if you have poor circulation, or if you are incontinent of urine or stool. Prevention of pressure ulcers is very important, and one of the best ways to prevent pressure ulcers is to relieve pressure on the bony areas, and you can do that by changing positions on a regular basis, and usually at a minimum we recommend every 2 hours. If you stay on that an open area, it's only going to make it worse, so definitely repositioning is very, very important. And you want to do that so that it allows the skin to get its normal blood flow back to those areas that are under pressure. And you might need to do something like use pillows to help reposition your patient as necessary. Pillows behind the back and between the knees will help keep the side-lying position that is necessary to keep them off the coccyx. and it also will help from the knees from rubbing together. There are other devices that can be purchased or rented to help prevent pressure areas, like egg crate mattresses or an alternating positive pressure mattress. They have elbow and knee, heel and elbow floats, so they're little cushions that your heel or your elbows rest in, and there's a cutout underneath it so that there's absolutely no pressure on those areas. And special seat cushions for the wheelchairs. You protect all the bony areas by applying a skin prep or tincture of benzoin, and it helps keep the skin tougher in those areas and a little more protected. And you can put either a hydrocolloid or a transparent dressing there also for added protection. Good skin hygiene is imperative to preventing pressure ulcers, especially after incontinence. Massaging lotion into the bony areas after cleaning and when repositioning will help increase the circulation to the tissues under pressure. Keeping moving is key to pressure ulcer prevention. When muscles are not being used, they rapidly begin to weaken and atrophy. Strength can decrease as much as 20 to 30% after only 1 week of complete bed rest. It takes much longer to regain the strength than to lose it. Doing either passive or active range of motion exercises with your client will be extremely helpful in preventing blood clots, pneumonia, bone weakening, muscle wasting. Immobility can lead to limited joint movement. Constipation is also common in people who are bedridden or on bed rest. A high fiber diet, increasing fluids, and exercise will assist with preventing constipation. Depression is also quite common of a health risk for those people that are bedridden. They are unable to take care of themselves and maintain the social life that they are used to. They may feel useless or that they are a burden to their caregivers. Many seniors begin to feel hopeless if they become bedridden, and this can be decreased or even prevented with proper care. Family and caregivers should make sure that they are caring for their loved ones' social and emotional needs as well as their physical ones. Many caregivers only focus on the physical needs and forget the social and emotional needs. This can be prevented by providing them with regular social activities, arranging for friends to visit, play games, and look through photo albums, do crossword puzzles, jigsaw puzzles, anything to keep them involved and help them lead as full a life as possible. Proper nutrition is also especially important to someone with a pressure ulcer. Extra protein like eggs, meat, fish, and beans is needed to help heal open areas. People who are bed or chair bound do not expend a lot of energy, so they do not burn off the calories they have taken in, and in turn they're not hungry, and therefore they skip meals, which isn't good. Your job as a caregiver is to be sure the client eats. First, make a list of the client's favorite foods. A variety of meals is especially important. Most people like to eat different meals every day. It helps keep the day interesting for them. Depending on their ability, the client might also enjoy helping with meal prep. They could do simple things while either sitting down or maybe even lying down in the bed. Caregivers should know what to expect when caring for a bedridden client so that they will know how to prevent the common health risks related to decreased movement and mobility. Following these tips is a good way for caregivers to care for their clients while also preventing possible health risk complications related to their immobility. Thank you so much for watching this edition of TLC Academy. Have a great day. Thank you.